Question: do you have urgency to pee? Do you have frequent urination? Is there a burning sensation when you pee? Is your urine foul smelling? Hi everyone. Today I will be talking about urinary tract infection. What is urinary tract infection, you may ask? So I just described the classic symptoms of urinary tract infection. These are just some of the symptoms, but these are what you'll experience more often. So you'll have that burning sensation, frequent urination, that urgency to pee. In more severe cases, there could be abdominal pain or there could be blood in the urine. So let's discuss this some more. So the urinary tract includes the urethra, the bladder, and the kidneys. Let me show you a diagram. So as you can see, there is the urethra, then there is the bladder, then there are the kidneys. Okay, so now you know what the urinary tract looks like. So if you have an infection of the urinary tract, it is usually caused by a bacteria called E. coli, and this bacteria enters the urethra and travels up to the bladder and multiplies, and then it presents with these symptoms that I discussed before. What are the causes of urinary tract infection? It could be caused by wiping from back to front. So the bacteria that is E. coli is usually present in the anus. That is your bum hole where the poo comes from. So if you're using the washroom and you're wiping from back to front, you will transfer bacteria, such as E. coli, from the anus area to the urethra, and this bacteria will travel up into the bladder and cause a urinary tract infection. Another common cause of a urinary tract infection is it's common in women who are sexually active or women who have more than one partner, sexual partner, because that's also another way of just introducing bacteria into the urethra because they're so close to each other. Let me show you a diagram also of that. So if you look at this diagram, everything is pretty close to each other. So there's the anus, then there's the vagina, and then there's the urethra. So it's easy to transfer germs from one area to the other. So that's why having sex is a risk factor or a cause of urinary tract infection. We'll discuss the preventions later on. Another cause could be, or a risk factor could be, if you're diabetic, if you're immunocompromised, or women who are going through menopause may also notice an increased risk of urinary tract infections. So those are just some of the causes of urinary tract infection. We can prevent urinary tract infection by doing simple things. Like when you go to the washroom to pee, remember not to always wipe from front to back and never wipe from back to front, because as I explained before, you don't want to transfer germs from the anus to the urethra. So always remember, wipe from front to back. For women who are sexually active, always try to urinate, pee, after you have sex. So drink some water and use the washroom to flush out any bacteria that may have entered into the urethra or the urinary tract. Try to drink lots of water throughout the day, and this also helps to flush bacteria from the bladder. So these are just some of the ways to prevent it. Also try to prevent using feminine products such as powders, deodorants, or anything that is scented, because these can irritate the vaginal urethra area. What is the treatment for a urinary tract infection? It should not be treated at home with home remedies. You should see your doctor to get antibiotics. There are several antibiotics that are used to treat the infection, and sometimes your doctor will do certain tests to see what bacteria is present and treat it with the appropriate antibiotics. So some of the antibiotics include Septro or Bactrim. If you have a sulfur allergy, you would not use this medication. However, there are other options like macrobid or nitrofurantoin. There is also cephalexin, and those are some of the common ones. In severe kidney infections or complicated UTI, they will go to the fluoroquinolones such as ciprofloxacin. So these are just some of the examples and choices of antibiotics that your doctor may prescribe for you. Some of the key points for these antibiotics, for example, if you use Monorol is a powder antibiotic. So remember to dissolve it in cold water, about a half a cup of cold water, and drink it immediately. If you have any calcium products, dairy products, antacids, space these 2 hours from your medication. If you're taking Bactrim, drink adequate water, but don't drink too much water to dilute the concentration of the medication in the bladder, because you want it to be concentrated to get the maximum effect. For macrobid, you normally take it with food, and it sometimes makes your urine a bright yellow color. Okay, that's it today, guys. If you have any questions about this topic today, just post them in the comment section, or you can link me on Facebook. Have a good day. Remember to subscribe. Thank you. Bye.